Hi everyone, welcome back to my channel. So today I'm going to talk about Myers cocktail, glutathione, high dose vitamin C. I actually, so this was a treatment that I did in Mexico. I've done them here before as well. And when I came back from Mexico, I started doing them again, especially after the fluoroquinolone antibiotic. But one where I was getting the IVs done here, and the nurse here actually told me that in Mexico they can do higher doses of vitamin C, because I did one here with vitamin C and I didn't notice. I was like, oh, this one isn't as bad. And he goes, yeah, because we can't use the high doses that they use in Mexico. And I did notice when I did the IVs in Mexico, one of the side effects was like stomach upset. Even though it's an IV, for whatever reason, my stomach just gets very upset from the vitamin C. So, I had to take, an acid reducing medication in order to tolerate the IV. So the dosage must have been pretty high. I'm trying to think what it was, because some of the other patients there that were getting treated for cancer had much higher doses of vitamin C than I did. Mine was mixed into the Myers. They were getting like an individual. I mean, the bottle that they were getting of vitamin C looked like a bottle of peroxide, like upside down, just filled with vitamin C IV. I wasn't getting that much, and I was still getting a pretty decent dose. So mine had vitamin C, B vitamins, and glutathione. They would sometimes add like NAD to it, and like I think they would add other things too, maybe some like minerals, and stuff like that. But as far as I know, it was just like a Myers, B vitamins, vitamin C, that kind of thing. I do feel like these helped. Just that the vitamin C, like I said, was hard on my stomach. I had to take an acid reducing medication. Um, they can take a long time depending on what they add to it. And you just have to be, you have to be aware. I would have to ask, I would tell them, like, hey, you need to let me know what you guys are putting in this. That way I know how to prepare for it, because the vitamin C will mess with my stomach. And sometimes glutathione, I've noticed in the past that glutathione, would like give me depression. I would get really depressed. And so I did remember, like, after some of these, I would feel kind of sad and upset. And I was just like, what's in it? And they would say, oh, glutathione, that kind of thing. So, I could tell that there were certain things in it that they, because a Myers, to me, a Myers cocktail is like the vitamin C and the B vitamins. Glutathione is something separate. NAD is definitely something separate. And a lot of times they were just mixing these all in together. So I would tell them, hey, you need to let me know what's in this before you start administering it, because, I will know regardless. I'll find out no matter what, because my body can feel it. But I think sometimes they think that you won't be able to tell, but I'm so sensitive that I could probably like individually just point out, like, oh, it has this, and this. Did I notice anything from these? I want to say that yes, like, maybe a bit of energy. I did talk about how in my video where my 1 year post Mexico trip, I do talk about, my menstrual cramps have still been controlled. I don't know if it was from these IVs, because I did have several other things, while I was there. But it could be the IVs. Maybe they just kind of reset something. The one thing I will say, and I didn't know this about glutathione, is that glutathione is actually like a skin lightening treatment. And, I guess in certain countries they use glutathione, to lighten their skin. I didn't know this. And one thing for whatever reason, I remember, and I mean, you could probably look at my past videos. I don't know if you'd be able to notice it because sometimes I'm wearing makeup. I remember that I was starting to have hyperpigmentation, like here, like a mustache, almost like a melasma, but like lighter, because women with melasma, that's very, very pronounced. But I was noticing that I was having like some weird pigmentation, like on the mustache, almost like I had like a stash, and then also along the sides of my face, like here and here, which would be where the sun hits, like when I'm driving my car. And even here, I remember I got sunburned once. I was like at like some kind of like a fair, and I got sunburned here, and I remember it left a mark there. Like even when the sunburn went away, I still had like this weird hyperpigmentation here. I don't know what it was. I mean, it could have been the exosomes as well, because I did notice improvement in my skin with the exosomes. But I kind of started putting two and two together when I was Googling glutathione. It's used as a skin lightening treatment. And I have noticed that hyperpigmentation that I used to, like, I remember I would notice it a lot, like, especially if I didn't have makeup, I would notice that weird mustache and sort of the discoloration here. It wasn't like super apparent, but I could see it. It was just this like weird, discoloration there. And I haven't noticed it in a while. And I'm wondering if it was from those IVs from the glutathione, because I was getting it done intravenously. And then when I got back, I was doing, I did some of that here. And then this year I also did that again. And I'm actually taking oral liposomal glutathione because I'm noticing that is helping with the side effects from the fluoroquinolone antibiotic. For example, like leg pain and stuff like that. So I've started taking it and taking it pretty religiously, um, you know, lipos, orally. The IVs are very, very expensive. And to be honest, I feel like the liposomal one, having it every day, is probably like, it's more consistent and I tolerate it pretty well. So I don't know. I think it might be that because, I was looking at my skin and I was like, I remember having that weird discoloration and I was like, it would drive me crazy because I have not had children. I've never been pregnant, and that type of discoloration is usually associated. It's called melasma, and it's usually associated with hormones and pregnancy. Yes, a lot of it, you can have discoloration from the sun. That's what I'm thinking it's from, or it was from, because there was a time when I didn't wear sunscreen. But I didn't know that something like that could make that discoloration go away. I always thought that you had to get it lasered in order to make that discoloration kind of disappear. Um, but apparently, I mean, something did it because I remember it being very apparent. The mustache was the one that bothered me the most because without my makeup, I was like, it looks like I have a little bit of a mustache. It's just like a slight darkening. So I don't know, but all I can say is that I don't really see it that much anymore. I've been very diligent with my sunscreen and wearing a hat if I go outside. And again, I was in Puerto Vallarta, which is very tropical, and if I was going to get a suntan or get more discoloration anywhere, it would have been there. I made sure to put sunscreen on my face and my arms and stuff, but to be honest, I wasn't that diligent with the rest of my body. And I'm not seeing like a lot of that sort of hyperpigmentation, especially on my face. So I don't know. I don't know. That could be it. But yeah, those were the Myers cocktails, glutathione. Again, it's an IV. It was done through an IV. This clinic they had excellent nurses that were great at putting in IVs. But that's really all it is. And it can last a few hours depending on your tolerance. But yeah, that's about it. So thank you so much for joining me, and I'll see you guys in the next one.